And finally, we can head over to our endocrinology section. Now, what's the mnemonic for this system? That is DART, DART, diabetes, adrenals, reproduction, and thyroid. And this section is going to be very short and quick, I promise. And why is that so? Glad you asked. That's because you have already covered all of these symptoms in the rest of the sketch. We're just going to give it a revision here. So sit tight as we're going to finish this as soon as possible. So just to reinforce the idea of DART, we draw a target sign and a dot here. Next up, for diabetes, we're going to draw a sugar daddy with a jar of candies that is really going to tell you about diabetes. Now, we're not going to discuss the symptoms of diabetes as we have already gone through the whole sketch, but just as a refresher, I would like to tell you that you have to ask about the constitution symptoms. For example, there's increased diet, which is known as polyphagia, and it comes with the polydipsia and polyuria. Then you're going to ask about the microvascular complications. For example, changes in vision, blurring of the vision, lights, floaters, and that's all because of the cataract. Then you can always ask about the features of chronic kidney disease, for example, pallor, breathlessness, itching, and all these stuff. That's because of the diabetic nephropathy. Then you're also going to ask about the neuropathy symptoms, for example, tingling, numbness, burning in hands and feet. Also, you're going to ask about the autonomic nephropathy, for example, diabetic diarrhea or urinary incontinency, and so and so. So these were the actually microvascular complications known as retinopathy, nephropathy, and neuropathy. Then you're going to ask about the past history of macrovascular diseases, for example, CVA, which is a stroke. Also, you're going to take a past history of MI and peripheral arterial disease. Now, the patient can also present in DKA and HONC. So be sure to rule out diabetes. Next up, this sugar daddy is madly in love with someone. So we draw your hearts, and these hearts are going to tell you about reproduction. Oh, the daddy likes to reproduce. Oh. So if there's a problem with libido or impotency, you can always go to our genitourinary section for more detail. Next up, we're going to give this daddy a thyroid bow. Now, this thyroid bow is dual representation of hyperthyroidism as well as hypothyroidism. And just as a refresher for thyroid, you can always ask about nervousness, irritability, insomnia, palpitation, shortness of breath, tachy, chest pain, ankle edema, appetite, change in weight, constipation or diarrhea, weakness or lethargy, sweating, intolerance to heat and cold. The same way you can ask about amenorrhea, skin complexion changes, change in voice, dysphagia, dyspnea, blood in saliva, which are the features of actually malignancy. You're going to differentiate thyroid from the thyroid cancer as well. And finally, you're going to ask about pain in eyes or diplopia. And then you're going to see the neck and see that swelling. I think it's enough for thyroid. And what else? This sugar daddy is wearing a brand new shirt from the Addisons. So you're going to ask about the Addison's disease, which we have already discussed a lot in detail in the constitutional symptoms and GI symptoms modules. So head over to there. And that's all about the diagnostic art to history taking. Now, before I go, I would like to share a template for taking history with you guys. Now, first of all, you're going to take the biodata. For example, a young male patient named XYZ, son of ABC of age ABC, was admitted to hospital on the date via emergency. He's resident of XYZ and ABC by profession. Now in these two sentences, you're going to cover whole of the biodata of the patient. Next up, you're going to ask about the presenting complaint, why the patient came to the hospital. And these complaints are written in chronological order, which means the first complaint of the patient comes first in the list, and the recent complaint of the patient comes at the bottom. For example, the patient was presented with the following complaints: fever for 7 days and chest pain for 2 days. Now you're really going to take the past history right from the start because this is going to help rule in or rule out most of the differentials. For example, my patient is a known case of diabetes, hypertensive, he is non-alcoholic. However, there is no significant history for drug addiction, hospital visit, previous accident, travel, etc. etc. Now you're going to take history of presenting illness in great detail, and this is actually our lecture. Just remember one thing, you don't need to ask all the questions to every patient. Just tailor them according to your need. And finally, you're going to take some other histories. For example, if it's a woman, you're going to take menstrual history. You're also going to take past surgical history, family history, personal history, occupational history, socioeconomic history, and then finally, you're going to ask the current medicine. And that's really all about history taking. Thank you for watching.